Hello everyone. I hope you are having a great day today. So this is Dr. Parkash, and I'm a fourth year MBBS student currently studying at Jamshoro. Along with me, the co-author of this article, Dr. Mohammed Zain, Dr. Kiran, Dr. Nana, Mubashir Ghani, and Dr. Arsalan Akil. So today, the topic of my discussion is to assess the cardiovascular risk factor in postmenopausal women attending a tertiary care hospital in Junction. Before starting with my topic today, I would like to provide a little introduction of the main highlight of today, that is cardiovascular diseases. So, according to WHO, CVD are a group of disorder of heart and blood vessel, and it includes coronary heart diseases, cerebrovascular diseases, rheumatic heart diseases, and other conditions. More than 4 out of 5 CVD deaths are due to heart attack and strokes. As we all know, the primary etiology behind the CVD is the increased risk of accumulation of fatty deposit inside the vessels, and then consequently increased risk of developing clots. So there are plethora of risk factors which leads to the development of CVD. And those include genetics, obviously, our age, our poor diet, our bad habits of smoking, our lack of physical activities, and others that have their fair share in the development of the CVD. Although we have seen men to be more prone to CVD than women, however, there is a one specific group of women that is at high risk of developing CVDs, that is postmenopausal women. So now our question shifts to what is menopause? So menopause is a permanent cessation of menstrual bleeding and insignificant production of our endogenous hormone estrogen. As we all know, menopause can cause many changes in the female body, but that's an other whole topic. So we will leave it for now. But in our study, we focused on the changes that are seen in the human body once they reach their menopause, which could aid in the increased risk, including heart-related diseases in women at that stage. And we also have seen increasing evidence that suggests gender-related differences in the anatomy and physiology of the myocardium, and that of female sex hormones could modify and alter the course of CVD. So our objectives were to assess the risk factor of developing CVD after menopause, which identify any changes in lipid profile that may lead to CVD, and find any association of chest or waist ratio with the occurrence of CVD in menopausal women. So designed. Uh, our study design was cross-sectional study. The setting was based in hospitals in Hyderabad. Our sampling technique was non-probability convenience sampling, and in our inclusion criteria, we only included those postmenopausal women who have achieved their menopause 1 to 5 years back. In our exclusion criteria, we exclude all those participants who have achieved their menopause less than 1 year or more than 5 years back. And we also excluded those females who had any known cardiovascular diseases. Our sample size was consisting of 131 participants. So now comes to the results. So as you can see, the descriptive statistics of our article, as you can see, the total cholesterol, LDL, and tax are quite high, whereas we can see that HDL is significantly low, and we can see the BMI of the all 131 patient is also high. Further, we correlated BMI with the other factors, and we found a strong correlation between with those factors such as total cholesterol, LDL, waist circumference, and chest circumference. Further, moving on, the number of cases according to the age, and we got majority of our cases in the age group of 46 to 50 years, and which consisted of 61 participants, which become 47% of total of our study. And the second is second largest group was of 40 to 45 years, and that consisted of 38 to 38 participants, which became 29 percentage, and so on. Further, we used different variables using ANOVA test, and we kept BMI dependent factor, and we got significant results here again. Moving on, we considered the family history and smoking history of our patient, and as you can see, majority of our participants were non-smoker, whereas you can see that majority of our participants has a family history of CVT, and it shows a strong correlation with these both. Further, we assessed the lifestyle of our participants, and we found out that majority of our participants were having moderately active lifestyle, whereas a minor group was having a very active lifestyle. But and the moderately one were consisting of those women who were doing their casual home chores. So we came to a conclusion that women experience reduction in estrogen production, which leads to various changes in the lipid profile, such as reduced HDL, elevated total cholesterol, LDL, and triglycerides. And this became the basis of increased CVD risk in female who have achieved menopause. Since these changes are in general are not seen in premenopausal women, this group has very less chances of getting cardiovascular diseases. So that's it for today. Thank you.